Native Americans, world apart, right next door, understanding a different culture. The project is done by Sarah Carbajal, Karen Frazier, Bridget Riley, Jessica Garris. Although Native Americans make up 0.9% of the U.S. population, they still play a vital role in today's society. It is the healthcare personnel's responsibility to understand the beliefs and values to deliver higher care. The history of the Native Americans is what drives the modern holistic care they give today. Their culture heavily relies on body, spirit, and mind. Values, beliefs, and attributes on the healthcare of Native Americans. Native Americans believe that they are one with nature and that sickness means there is an unbalance from nature or a supernatural act. Native Americans' methods of healings include chanting, burning sage or aromatic woods, taking herbal medication, harmonizing with nature, and partaking in ceremonies that can include taking hallucinogens. The biggest attributes to the modern healthcare is the herbal remedies that are natural and cost efficient. Native Americans during pregnancy and childbirth. During pregnancy, the health of the mother is very important. Native Americans tend to decrease activity and have a history of eating a healthy diet that consists of food that they believe will not have any effect of the fetus, such as raccoon and pheasants for an ill baby, speckled trout for birthmarks, and black walnuts that help with big noses. Childbirth is considered a spiritual event, even ceremonial. Many choose to deliver in an upright or squatting position. When compared to non-Hispanic whites, Native Americans have 1.6 times higher infant mortality rate, 2.2 times more likely to die from SIDS, and 2.5 times more likely to have late or no prenatal care. Growing up as a Native American. While growing up in a Native American home, the parents tend to be very strict. The children usually grow up with 2 to 3 siblings. Adulthood is determined at different ages depending on the tribe, but the transition is usually accompanied by a rite of passage. And they are taught to hide their emotions from a young age. Emotional strength is the goal to all good households. Health issues for Native American adults. According to the Indian Health Service, IHS, Native American adults' life expectancy is 5.2 years less than the average life expectancy of other adults in the United States. Native American adults suffer from higher rates of tuberculosis, alcoholism, diabetes, homicides, and suicides. Native American elders' health issues. Native Americans 55 and older have higher rates of hypertension, diabetes, back pain, and vision loss. Most predominant conditions are hypertension, arthritis, and diabetes. Chronic pain may be undermedicated due to culture of stoicism. May treat pain with traditional medicine, including visits to healers, taking herbs, prayer, and singing. Elderly Native American and long-term care. Elderly Native Americans have faced many challenges and often had parents or grandparents who had negative experiences with the American government, including genocide, forced removal from homelands, forced sterilization, and separation of family through forced boarding schools for Native American children. Due to this history of government abuses, Native American elders have developed a distrust of government agencies, including hospitals and long-term care facilities. It is important to take care when discussing long-term care with Native American elders in that they fear they will be taken away and never returned. Native American families usually prefer to take care of elderly family members.
Delivering culturally sensitive care. Tips for healthcare providers. Speak slower, allowing for silence so patients can think about what has been said. Silence means you are being thoughtful. Do not interrupt. Allow patients to finish their narrative. Defer to elders as they are highly respected. Direct eye contact may be considered rude. Do not misinterpret this as someone not listening. Pay attention to your body language. Respect the use of traditional healers. Talk to the patient about what the healer is helping them with. Know which herbs your patient is using and how they interact with medications. Be willing to help patients navigate the healthcare system. Government is not usually trusted. Use a holistic approach. Mind, body, and spirit must balance for health. Dreams are relevant, especially in mental health care. Allow patients to explain how they interpret their dreams. Gain knowledge of the tribe, community you are working with. Not all Native American tribes have the same cultural views.
The Indian Health Services quotes that community health tends to focus on people in specific geographic areas and the factors which affect their health. In regards to providing nursing care within the community, attention must be placed on preventative care, education, safety, and increasing access to care. Care of the Native American community requires nursing care on a much larger scale, as care is of an entire population versus a single patient or small patient group. Through use of outreach programs, nurses can provide care within the school systems, community centers, and homeless areas of a community. With use of the outreach programs, nurses can assess the needs of the community and determine the specific needs. In order to provide community care for Native Americans, there is a need for federal programs such as the Indian Health Services, or also known as IHS. This is a federal health program for Native Americans and Alaska Natives, which is a part of the Department of Health and Human Services. Within the IHS, there are specific areas that are focused on, which include behavioral health, environmental health, health promotion and communication, injury prevention, and school health. According to the IHS, substance and alcohol abuse, violence, and suicide have a high prevalence in Native Americans, requiring attention in behavioral health. Environmental health is necessary as Native Americans face frequent encounters with environmental risk. With health promotion and communication, focus is placed on cultural competence and enhancing preventative measures. With injury prevention, it is seen that injury is the leading cause of death in Native Americans. Children have an increased risk for diabetes, obesity, and dental cavities, which requires community focus on school health. Each focus are equally important to ensure that the Native American community receives cultural specific care that meets their needs. To evaluate possible community health opportunities, a systematic literature review was conducted on telemedicine within the Native American population. The Native American population sometimes has poor access to health care, and the health care available does not always meet specific needs. For example, in the study conducted by Cruz, Beaufort, Daughtry, and Perot, children have access to family care providers but are rarely seen by actual pediatricians. With use of telemedicine, children could have the opportunity to be seen by a pediatrician. Telemedicine offers a modern approach to healthcare and can potentially decrease healthcare costs for Native Americans. Through use of telemedicine, Native Americans can have a more readily available resource. The Native American culture requires cultural specific care. Through constant education, review of peer-reviewed literature, and active involvement within the community, nurses can meet the health care needs of Native Americans. In conclusion, we hope that you gained not better knowledge of how to serve the Native American population. Thank you for listening.